All righty. Welcome, everyone. Thank y'all so much for joining today's presentation, Community Resources for Family Caregivers. My name is Ariel Green, and I'm the Caregiver Support and Education Specialist for Care Partners. And I'm joined by a wonderful group of people that are going to share a lot of great information today. Livy, I see your face. This is going to be great. Really excited that everyone is here. And so the way that it's going to work today is that we're going to hear from several community organizations that support family caregivers. And so each of them will spend about 10 minutes speaking about their services and their organization, and then we'll ask questions throughout their portion of the presentation. And then at the end, we will ask them to stay on and answer any additional questions that you all may have. This presentation will be recorded. We will be sending out that presentation along with any additional resources such as a PowerPoint, handouts, anything that is shared throughout the presentation. So for the sake of time, I want to be respectful of everyone's time. I'm going to turn it over to Eddie. You will hear about Care Partners at the end. So usually I would have done that in the beginning, but we're going to do that in reverse today. And so I'm going to turn it over to Eddie, who is representing AARP. And they are actually one of our sponsors for our education programs. And so we're so grateful for their partnership. And so Eddie, you can take it away. I think we can see your screen, so you're good to go.
Thank you, Ariel, and good afternoon to everybody. Let me say that AARP is very pleased to be a part of this project, and we hope to continue our partnership with Care Partners. AARP is a nonprofit, nonpartisan social mission organization with a membership. What we intend to do is to live out the philosophy of our founder, Dr. Ethel Andrus. Dr. Andrus was actually a retired teacher. AARP began as a retired teaching kind of association, but she then noticed that one of her associates was actually living in a chicken coop because of a lack of resources. So the organization began to flourish into being prepared to take care of elders, the 50-plus generation, in the way that we choose. We do several things to protect and to represent caregivers. We believe our purpose is to empower people to choose to live as we choose as we age. We have a vision that a society in which all people live with dignity and purpose to fulfill their goals and dreams is extremely important to all of us. So as we go through preparing to care for our loved ones, we believe in the words of impact, innovation, humanity, empowerment, and honesty to express exactly what we believe in. We also advocate for caregivers. We're in our state and national organizations and federal governments to make sure that policies and legislation to affect the 50-plus generation, to make sure that we are doing what we can do to protect you. We're in the community. We provide fraud watch networks for caregivers. We do all sorts of things to help the aging population to ensure that we're living our best life. Primarily, our goal is to prepare to care. When we say prepare to care, we're really asking the question, as we age and as we take care of our loved ones, are we prepared to care? We like to look at employer services as well. So we can actually go into your businesses and to make sure that you have an employer-friendly, valued environment that takes care of caregivers. When we talk about preparing to care, how do you begin that most difficult conversation? So we actually help you to have strategies to talk with your loved ones. How do you develop the team? How do you find community resources such that are online today? How do you take care of yourself? And how do you find the resources through AARP? And we're going to talk about what AARP provides. One of the things that's important to know that as we talk about preparing to care and our other information as well, we have a website that you can find all of the information, www.aarp.org/caregiving. We also have a number that you can call anytime you might need services. To make sure that our caregivers are staying healthy themselves, as we talk about caring for yourself, it's important to us that we look at brain health, continuing to be social. So we actually have exercise classes. We have gatherings of cooking classes, how to engage your brain, managing stress, ongoing exercises, restorative sleep. We want to make sure that the caregiver is very prepared to care for him or herself, as well as their loved ones. It's also important to know that estate planning for caregiving is very important. How do we prepare our loved one's estate? What kinds of things do we need? Is an attorney needed? How do we choose who's going to oversee our estate? Where should you keep your will? How are you going to be financially impacted and those around you by your death? So being a caregiver is extensive to this extent that we want to make sure that we help our caregivers to be prepared in all aspects of caring for their loved ones. We also believe in making sure that men are also looking at our caregiving needs. We know that men care differently. We don't look for resources as well. So we prepare men to be caregivers. We also understand the grieving process is different. It's not that one person grieves the right way and the other person grieves the wrong way. It's just the more that we know about how we grieve, the easier it is to support us in our grief. The same thing with mental health issues. So AARP definitely looks at the male category of caregivers. We also look at veterans, and you're going to hear more about that from one of the other speakers. But we make sure that our caregivers who are taking care of veterans and military families also have specific information that's adequate to them. We also have what we call mindfulness classes, Monday mindfulness, where we actually look at how do you reduce the stress upon yourself as that caregiver? How do you become aware of your present? How do you simply take a deep breath? And how do you be the best that you can be? We mentioned earlier about resources for employers. We actually have a toolkit for employers. We can actually bring in our Prepare to Care workshop to employers such that, again, our employers are in a specific position to be aware of, care for, and support their employees who are caregivers. We have supporting working caregivers, case studies of promising practices. So we have extensive information to prepare caregivers. We also have what we call the financial workbook that we mentioned earlier, the Prepare to Care guides, and we have our caregiving resource line. Most importantly, I want to mention, we have group forums and chat focused on caregiving. If you're uncomfortable talking within an open group, here's an opportunity to bring your very complicated issues into a different type of group. The videos, everything that we do is online. We have resource guides. As we look at information, it's also important to know that we rarely talk about family conflict. Primary caregivers often are pitted against their siblings. So at AARP, we offer information and strategies to help you navigate that very complex situation as well. We want to make sure that you have medication management. We talk about how it changes as we age, and we have our videos. Most importantly, we want to say AARP is here for you as you're caring for your loved one. In fact, I'd like to end by stating something that our former First Lady Rosalind Carter once said to us. There are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will receive care. At AARP, we try to support each category of those folk. Thank you. Ariel, I'll turn it back over to you.
Thank you, Eddie. Thank you so much. This was helpful and informative. And so I'm looking in the Q&A to see if we have any questions. If you have any questions for Eddie at this time, please put them in the chat. If not, we'll move on to Adrian from the Alzheimer's Association. If you think of any additional questions that you have for Eddie or anyone else, we can answer them also at the end of the presentation. But thank you so much, Eddie.
Thank you.
Eddie, you should work for the radio.
All right, thank you. Let me go ahead and share my screen.
Okay, so the next person that we will be hearing from is Adrian. She is with the Alzheimer's Association. So thank you so much for joining us, Adrian, and we can see your screen.
Great, thank you. So I am a program manager with the Houston and Southeast Texas chapter of the Alzheimer's Association. I'm very glad to be here. My program, my department, we focus on care and support. So I was trying to sift through all of our resources to just narrow it down for caregivers. So first of all, our focus is on Alzheimer's and dementia. Eddie is one of our community educators, so I'm a little nervous speaking in front of him because he's talked about this a whole lot more than I have. But specifically, Alzheimer's is a brain disease that affects memory and thinking and behavior. And I'm going to skip that because if it's in your household, you're already aware of that. But our vision is a world without Alzheimer's and all other dementia. And so to that end, we are leading the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction, early detection, maximizing care and support. So focusing today on the care and support part of that. There's a lot of other things that we do, but specifically looking at care and support, supporting you as the caregiver, caring for you, helping you care for your loved one. Before going into too much more, I do want to highlight how important it is for early detection. So if you're caring for somebody and you're starting to notice changes in their behavior, in their memory, in their speaking patterns, really want to encourage you to speak to a doctor sooner than later. We continue to have treatments developed that are, many of those are geared towards the early stages of the disease. So the sooner you can start partnering with a medical care team to address that, the better. It also gives you as the caregiver that much more time to plan with your loved one, to plan with your family, and really equip yourselves as best as you can to support yourselves and your loved ones throughout the journey. So looking at how caregivers are impacted, you may be really present to how your household is impacted, but bigger picture, it's also a really big deal. So in 2023, there were over 11 million Americans providing unpaid care, and that costs a lot of dollars. The ones that really catch my attention, though, are the ones in the bottom two corners. So that physical, emotional, social, and financial toll. Eddie was speaking to some of that cost that people have to take on when they're caregiving, but also emotional stress is just so high. I'm going to minimize this in case that's covering up any of my screen there. And they've shown, there's been studies that show that people who are caregiving for people with Alzheimer's or other dementia, they're even a higher risk of anxiety or depression than people who are caregiving for other reasons. So it just has a very high cost in a lot of different areas. And so that's why it's one of our target vectors of meeting that need and addressing it so that more and more people are supported and equipped for handling this.
Adrian,
yeah.
we're having a hard time hearing you. It's very low. And so
okay.
I just wanted to let you know.
Is it better if I aim my microphone a little differently?
Yeah, it's a little bit better. Thumbs up to Andrea. Can you hear okay? Are you able to hear? So I just wanted to make sure it wasn't just me. Yeah.
If you just, and speak up just a little. So aim it right to your mouth and speaking up might help. Yeah.
Okay. Are y'all able to hear me if I speak up a little louder?
It's about the same.
Yeah, I don't think so.
Okay.
We'll just roll with it. We'll roll with it.
Thank you for letting me know. I'll speak up. I generally speak very quietly. So I'll get it'll feel shouty to me. Okay, thank you for letting me know. So if you take away only one resource today, I would want that to be our 24/7 helpline. So that is, as its name, 24/7. We have people that speak over 200 languages on that call. They are master's level clinicians. They're able to help you process those middle of the night crises, or if you want to know who to call for a particular kind of resource, but you don't want to have to read the whole internet to find out, or if you know you need a support group and you don't know where to go and you're overwhelmed because you're taking care of too many other things, calling this number can shortcut all of those questions and allow you to just say, hey, I am dealing with this and I need blank. And they can say, okay, we got you, and help answer those questions right away. So that's where I always want to point first. Outside of that, if you need a little bit more information, you have a little bit more bandwidth, We've got gobs of resources. Support groups would be the next thing that I would want to point you towards as a caregiver. That's where you can be in a room of people who get it and understand it, and they're for you. And it's okay to be sad or mad or overwhelmed or processing a lot of things and trying to make decisions. And there's people that want you to be okay, but also understand what you're going through and want to work with you on that. Here's more information on the support groups. We have several around the Houston area. We have some that meet online. There's some that are specific to people that are in the early stages. There's some that are specific to folks that are dealing with early onset Alzheimer's. And then there's some that are just for men. So as Eddie was saying, sometimes men just aren't equipped to be caregivers, and they're finding themselves in very unfamiliar waters. And so being around other people trying to work through that and process it and show up well is a really powerful space. Next most important thing I would point you towards are two sources. There's the ALS Navigator, and I don't know if you've gone to alz.org, but there can be a lot to process on that website. This one, again, like the 1-800 number, shortcuts that, and you can just say, I am a caregiver, I am facing a diagnosis myself, I'm wanting to help. And it's just very easy to answer, very simple, and it walks through helping you put a plan together, how to find local support, putting legal and financial plans in place. It's just very simple and straight ahead. So that would be alz.org/ALS Navigator. And then the next one like that is ALS Connected. And so that is also helping you get connected. It's forums, you can browse message boards. Often people will ask questions that maybe you didn't think to ask, or that you might ask in a year from now, but they're not on your head yet. So this is a great spot to just kind of equip yourself and orient and ask a group of people and work through that. Beyond that, there's also our community resource finder. That is a partnership that we did with the AARP. This is the same thing basically as calling the 1-800 number, but if you're like me and you don't like phone calls, or if you don't have time for that, this can be a good way to plug in and just say, I need this. One tip that I would offer, it says here you can conduct a search based on zip code, but you'll need to sort by distance if you're doing that. So if you plug in support group near me in 77084, the first things that may pop up could be an online support group in Colorado, because that's tomorrow. And because it's online, you can go to it. But if you're like, no, I really want something in 77084, then sort by distance. So just a note on that. I'm going to skip this because you're already helping people as a caregiver, and that's a lot on your plate. But I wanted to let everybody know, I'm sorry the skewing is a little funky here, but we have our Caregiver Symposium coming up in June. And Care Partners is our platinum sponsor on that. So we're going to be really focusing on helping people avoid scams, protecting their assets, putting together all of the different components that go into financial and legal planning and managing all of those different pieces to set yourself up well. I don't know how long I've talked. I apologize. I didn't set my timer.
Yeah, you're good. Thank you, Adrienne.
Okay.
This is helpful. And I just want to say that helpline, it really is 24/7. Please call the helpline, especially if it's in the middle of the night, you have a question or you need a resource. It is so helpful. And thank you, Adrienne, for sharing that with us. And I'm going to check the chat to see if there are any questions that have popped up for Adrienne. If not, we'll move on to the next person. If you think of a question, I am monitoring the chat, and so I can ask it at the end. So I don't think we have any specific questions for Adrienne. Thank you. And the next person that we have up is Sonia from the VA. So Sonia, if you can, you should be able to share your screen if you have a PowerPoint.
Okay,
Okay.
I do. And let's see.
And we'll give it a minute. As you're doing that, I'm going to continue to monitor the chat.
Okay.
We'll go from there. But this has been very helpful. Very helpful. let's see here.
Sonia, fix
Try
your
to
camera.
see
We can only see half your face.
if I'm bringing up the right screen.
And yep, we can see it. We can see your screen. You just have to,
I'm trying to get to slideshow.
and then before you get started, Eddie, there's a question in the chat for you, just FYI. All right.
Hey, Ariel, are you seeing a larger screen?
Yes, we can see your notes. We can see the slide you're on now and then the next slide. So it's on a presenter. We can see what you see as a presenter.
You may need to
Okay.
change your display settings. There you go.
That's what I want to do.
There you go.
There we go.
Perfect. That's awesome. All right, well, I'm gonna turn it over to you, Sonia. I'm gonna mute myself now.
All righty. Well, good afternoon, everyone. My name is Sonia Nelson. I'm the Community Programs Coordinator for the Michael E. DeBakey VA Medical Center here in Houston. I am just going to talk to you briefly today about VA personal care services programs because our geriatrics and extended care is one of the largest services that cares for veteran in the community care arena, along with caregivers. So the personal care services programs really benefit the veterans and their caregivers. Our VA Geriatrics and Extended Care Services administers personal care services, or what we call PCS, services that allow veterans to age safely in their homes and independently for as long as possible. These programs also provide built-in respite for the primary caregiver. The biggest programs are Homemaker Home Health Aid, Community Adult Day Health Care, Respite, both home and inpatient, and Veteran Directed Care. So once the veteran is assessed by their primary care team and determined to be clinically appropriate for the service, they can spread those approved allotted hours across the various programs to best meet their needs. The primary goal is to support veterans who wish to remain in their home with appropriate care and support. We want to reduce or delay nursing home placement, of course, and improve the veteran's quality of life and safety in the home. The secondary gain or goal is to support the primary caregiver in the daily care of the veteran. We want to be able to provide timely, regular, and ongoing respite for the primary caregiver to reduce or decrease caregiver burnout, which, if not managed, will increase the chances that the veteran is going to end up in an institutional setting quicker. Eligibility, we look at long-term care patients, those who are at risk or high risk of requiring nursing home placement due to a variety of functional impairments, behavioral problems that are associated with diagnoses such as dementia on the Alzheimer's spectrum, Parkinson's, that kind of thing, advanced age and frailty. We look at those veterans who clinic follow-up has been insufficient. These are those patients who clinic follow-up has not been able to adequately maintain them and their medical stability in the home. They keep requiring frequent clinic visits, and/or they end up in the emergency room quite often, even though they're seeing a primary care physician on an outpatient basis. Impaired cognition, patients who have diagnosis with significant cognitive impairment to the degree that their ability to remain in the community setting is endangered. And we also provide wraparound services for those community transitioning patients, patients who are transitioning from an institutional setting. Maybe they had to go for a short-term stay, and we don't want this to end up as a long-term placement. Somebody's mic is open. Okay, patients being discharged from intermediate care facilities, rehab units, and nursing homes. So we'll first start with the Homemaker Home Health Aid program. And we know this is a program for veterans who need personal care services, help with activities of daily living, and it's for veterans who are isolated or their caregiver is experiencing burden. A homemaker home health aide is a trained person who can come to the veteran's home and help them take care of themselves in their daily activities. Homemaker home health aide services can be used in combination with other home and community-based services and may vary from location to location. The next one we utilize is adult day health care. It's a program where veterans can go during the day for social activities, peer support, companionship, and recreation. This program is for veterans who need help also with activities of daily living. Examples could include bathing, dressing, or fixing meals, because these are services that can be provided in an adult daycare setting. This program assists veterans who are isolated or their caregiver is also experiencing burden. Adult day health care at Michael E. DeBakey is provided by community providers in the community who we contract with to provide the service to the VA. We don't actually provide it on site. We contract out with providers who are licensed in the community. Adult day health care can also be used in combination with other home and community-based services. Next is home respite. This program is for veterans who need help with activities of daily living. Examples can include bathing, dressing, fixing meals. This program can assist the caregivers in reducing caregiving burden as well. Respite care can help lower the stress the veterans and their family caregiver may feel when managing short-term or long-term care needs at home. Respite care can be used also in combination with other home and community-based services that we provide. Inpatient. Inpatient respite is also available to all veterans enrolled in VHA, Veterans Health Administration, and have a clinical need for the service. Our inpatient respite services provide support to the primary home, in a VA contract nursing home, or in the community living center. Now, this will vary from facility to facility based on bed availability. This type of respite should be scheduled in advance. The inpatient respite is provided 30 days per calendar year. It can be used all at one time or intermittently at the discretion of the veteran or their primary caregiver. They often use this if you have caregivers who are going out of town and they want to make sure that the veteran is placed somewhere so that they can get the care that they need, or they just need a short-term, brief, uninterrupted for themselves. So they may place the veteran for 7 days or 3 days or however many times. Generally, they like to do this for at least a week. And every veteran is entitled to this 30 days per calendar year. The home respite, on the other hand, is an ongoing service that is part of the personal care hours that they're approved for. Then the last program is veteran-directed care. Veteran-directed care is a very new program as far as VA programs are concerned, which could have been around 60, 70 years. Veteran-directed care has probably only been operational in many places over the last 10 years. I started the program here at our medical center, and we onboarded our first veterans in 2017. So it's still a relatively new program. Veteran-directed care gives veterans of all ages the opportunity to receive assistance with activities of daily living and other personal care services in a consumer-directed way. And when we say consumer-directed, that means when the veteran or their representative comes into this program, they receive an IN number, employee identification number, and then are charged with hiring the care to manage the veteran in the home. Veterans in this program are given a budget for services that is managed by the veteran or the veteran's representative, and with assistance from a case manager that is provided by our VDC community provider, a local area agency on aging. Our actual community partner is on this call today. We are in partnership with Harris County Area Agency on Aging, and they're our community provider who helps us administer the program in the community. Veterans hire their own workers to meet their daily needs to help them live at home or in their community. The primary caregiver receives relief directly, as the additional employees hired are part of a team managing all of the veterans' personal care needs through a regularly scheduled rotation of care. So it provides ongoing and scheduled and routine respite for the primary caregiver. Services may vary by location, as the medical centers tend to focus their services to capture those veterans who are at imminent risk of institutional placement at the time of referral. So just to give you a little snapshot of how it may be used, we're talking about all of these programs, and they work in concert with one another or as a single standalone service. So you may have a veteran, let's say this veteran was assessed by the clinician and qualifies for up to 36 hours per week. That veteran can decide to spread those hours over any of the services that they want. Of the 36 hours, they may want to use 24 hours of homemaker home health aid, and then they might want to have 2 days of adult daycare. They can do that, and that's how they'll use their 26 hours. And you can see how the homemaker home health aid and the adult daycare would provide the respite for the caregiver, because you have someone who's coming into the home for 24 hours of care, and then 2 days a week, the veteran is out of the home at a facility. Option 2, they might want 3 days of adult daycare, and then they'll drop down and they'll say, we want to use 9 hours for homemaker home health aid, and then they want to use 5 hours of respite. Or they want to use, in our third option, you can use all 36 hours for homemaker home health aid. And so it is the choice of the veteran or the primary caregiver how they decide to utilize the hours once they're approved. And veteran directed care, if that were the choice, then all of these would go away, and veteran directed care would come in and be the primary service to manage all personal care needs. Because when a veteran opts into veteran directed care, they are opting out of the other 3 programs, except for inpatient respite. They are still entitled to 30 days of inpatient respite care per calendar year. Long-term care co-payments. What every person has to be mindful of when they come to the VA, depending upon what priority category they're in. Long-term co-payments may apply to veterans in certain VA priority groups who are referred for personal care services. Veterans in those identified priority groups are required to complete an extended care application. And the extended care application kind of looks at all the resources and finances to see what the veteran can and cannot afford. When you have someone, for instance, let's say who wants to go to adult daycare, or they want to utilize home respite, if they are probably either 0% service connected or a non-service connected veteran, they would probably be in one of these categories, and they would just fill out this form. It's called a long-term care application, or the 1010 EC for extended care services prior to being enrolled in the program. And if they have a copay, they will know what it is. I will tell you, for adult daycare, that it's going to be $15 a day, and it will be $15 a day beginning on day 22. So the first 21 days are at no cost. The monthly extended care copayment is assessed based on the information they provide in the T10 EC or extended care, and the type of extended care service they select. If they are designated as catastrophically disabled, that may impact the copay obligation. Most veterans who are catastrophically disabled will not have a copay. That would be determined with their primary care team. For any of this information, whether it is about the long-term care copays, whether it's about the availability of the programs, what program you want, any information that you need, you want to go to www.va.gov. That is your entry for everything. If it's an eligibility question, if you want the form, you can literally go on to, and I will go back, you can literally go on the internet and type in VA form 1010 EC, and it will populate that application. Or you can just go to www.va.gov for any of the information that I provided. And thank you.
Thank you, Sonia.
You're welcome.
This was a lot of information. So will you be able to share your slide with us? Your slides, is that we can share it out? We can share it to the group later. Is that okay?
Absolutely. And I think I just check your email, Ariel. I just emailed that presentation to you.
Okay, so good to see you. I haven't seen you in a long time.
You as well.
So this
Hi,
is great.
Livia.
Hey.
Livia
Andrea's
Lons
awesome.
there is the community part, is one of our community. She's our community partner with Veteran Directed Care from Harris County. Thank you all.
Thank you. Andrea is also on the call, Sonia. So,
Oh, okay. Good.
yeah.
Hi, Andrea.
Well, it's good.
They're one of our partners in the adult daycare program. So we just have partners all over the place.
Everywhere. Well, thank you. This has been very helpful. Let's see, I'm gonna see the chat. Okay, there's a question in the chat for you, Sonia. What service percentage does a veteran have to be classified as?
You're on mute.
Sonia, you're on mute.
Sorry. Ask that question again because I missed part of it.
What service percentage does a veteran have to be classified as? I'm guessing I'm assuming in, Ms. Foreman, you want to clarify your question, but they're asking about the service percentage.
There really is, there are certain programs that have service percentages, but our personal care programs tend to not have that unless we're looking at veteran directed care. And that's only because our target population are those veterans who are at imminent risk of nursing home placement and meet VA mandatory nursing home criteria. So those tend to be our 70% service connected and above. Everything else that I'm talking about is open to all veterans, whether you're non-service connected or not. The only difference it will be is if you're service connected, you're not going to have a copay. If you are not, you are likely to have a copay. Again, with adult daycare and respite, home respite, those things are generally about $15 a day, and they usually don't start until day 22, and they don't pay per day. They'll get the service, and then the VA will send out a statement, usually once a month. And so when you're looking at agencies that probably charge, $200-300, $200 or $300 a day to have somebody come in the home, you're literally only having to pay $15 a day for the hours that you're utilizing. And so if you only have 24 hours a week of respite, then once you get to day 22, then they'll start to look at what that is. The other thing is, generally, you have to have higher incomes and resources. When your resources and your income are on the lower end, generally that's what that application is for. It will help you be able to ameliorate having to pay a copay anyway. And also, I want to mention, you want to talk to your primary care team because they can help you in this respect, because if they get the classification of catastrophically disabled, they will not have a copay. So any of the things that we can do to help lessen the chance that the veteran may have a copay, we want to help them do that.
Great, thank you. My question to you, Sonia, is there a number for caregivers to call? I know there's many doors to get through to the VA, but is there like one central number, like how the Alzheimer's Association has like their helpline, AARP, like just for caregivers that they could just call with general questions to help them navigate all of this?
Yes, and I have 5,000 telephone numbers in my head, and I apologize.
That's okay. You can, if you want to put it in
I'll
the
get
chat.
the number, and before we're off this, I'll drop it in the chat.
Perfect. Awesome. So we will transition over to Peggy Dietermeyer with Hope and Healing. Peggy, you should be able to share your screen if you have a PowerPoint.
Yep.
I'm going to
Here I
turn it
am.
over to you and I will mute myself.
Terrific. Thanks, Ariel. So I'm Peggy Dietermeyer. The Hope and Healing Center is primarily mental health outreach. Important to note, all of our services are free of charge. On the mental health side, we have education and training programs through Gateway to Hope for peer mental health coaches. We have lunch and learns, not every month, but most months. We offer mental health coaching, both one-on-one for cognitive behavioral therapy and a combination of one-on-one and group work in dialectical behavioral therapy. One note is this is the part of our services that does have a waiting list. So if your loved one needs this kind of support, best to get in sooner rather than later. We have a bunch of different support groups, including 12-step programs, survivors of suicide. We have 3 programs that are targeted for mental health. One is called Hearts Transformed for victims of trauma, Minds Transformed for mental health sufferers, people with serious mental illnesses, Families Transformed for families of individuals with mental health issues. We have telepsych services for people who can't get psychiatric support in a timely manner. You do have to be a client for our CBT or DBT services to qualify for that. We offer case management for different resources for if you need mental health support in a particular area. For example, the Hope and Healing Center does not do family therapy, but if you need family therapy, then you can, our case managers have resources that they have vetted. And then finally, we have some research programs we're doing. And I say this only as background because there are lots of caregivers who also have more serious mental health considerations that they have to think about. CARES is the program that I'm responsible for, with CARES being an acronym for Caregiving, Aging, Resilience, Ethics, and Spirituality. And as with our mental health services, all of our services are free of charge. We have some regular programs that we offer. We have Aging with Grace. That's a 4-week series offered in the spring and fall on the financial, legal living, and financial aspects of aging, including caregiving and things to know about Medicare and Medicaid. We have monthly lunch and learn programs, most of which are hybrid. Some of them are virtual. They're usually at noon on the 3rd Thursday. The program this month is a professor at the University of Houston Medical School who's a psychologist and going to talk about mental health issues in various constituencies in the Houston area. And then we have a program we call Caregivers Corner. It's a 5-week caregiver education course that covers self-care, disease progression, behavior management, things to know about accessing different Medicare and Medicaid benefits, different living options, and that's offered in the spring and fall. Then we have resources. We have a monthly grief support group. One group meets virtually on the 2nd Tuesday of the month in the evenings from 5:30 to 7. Seth Stander is my colleague here. He runs a group on the 4th Wednesdays from noon to 1 p.m. We have a very broad definition of grief. So it's not just for folks whose spouses or loved ones have died. It's also the grief that comes with the ambiguous grief that trying to deal with the challenges of caregiving. We also have an Alzheimer's dementia caregiver support group on the 1st and 3rd Mondays of the month at 3:00. That's a hybrid program that's run by Kathy Tellefson here, and that group has been in play for years, literally. They run 12 months out of the year. We also have a virtual general caregiver support group that's not just for dementia caregivers, but also for folks who are caregiving for folks with chronic illnesses. And that's on the second Friday of the month from 10 to 11 in the mornings. We offer individual coaching for folks who have challenges that they need to talk about one-on-one, and we can be very flexible. We can meet either in person or virtually on Zoom or Teams or on phone, and that's by appointment. We offer a community healthcare ethics consultation service, which has care planning for those with chronic or life-limiting illnesses, of course, including dementia, but also any other kinds of, a lot of people who have dementia also have general medical challenges that complicate their treatment. And it's sometimes difficult to get straight answers from doctors about what's going on. And so we have recruited some docs, nurses, chaplains, social workers, and others who will provide support in this area. And then we offer, we have our CARES resources. As I tell people, that's not intended to be a comprehensive resource, but it's the product of the years I've been with the Hope and Healing Center, which is now almost 8 years, of the questions that people have asked. So it covers dementia resources, caregiving resources, home care resources. I have contact information for the Alzheimer's Association, for Care Partners, for the VA, just anybody who's anyone, and even have information on inexpensive funeral services and folks who want to donate their bodies to science. Like I said, it's an outcome of people asking questions. I also have a list of resources where you can donate or sell your stuff if you're trying to downsize. And we update that regularly. And if you just shoot us an email, you can get a copy of that. That's a lot of information, but I'll send these slides to Ariel so that she can share them. Here's the contact information for Seth Stander and myself. And you can call us and we'll try to help in whatever way we can.
Thank you.
Questions, comments?
Thank you. I think you answered the question about the slide. You'll be sending it out. Somebody was asking about that.
Yeah, I'll send that to you, Ariel. I apologize for not sending it to you sooner.
It's okay. Thank you so much. Does anybody have any questions for Peggy? If not, we'll go ahead. I think we're doing pretty good on time. And if you have a question, just type it in the chat. We're all able to see the chat. So Peggy can see it. And if it's a question that I can answer, I will answer it as well. So awesome. Well, we will move to the next person, just Libya from the Harris County Area Agency on Aging. Libya, you're on mute. There you go.
Good afternoon, everybody. My name is Libya Lance, and I'm a senior counselor for Harris County Area Agency on Aging and Care Coordination and Aging and Disability Resource Center. We're under the Health Department and under the Human Services Division. Next slide. So Harris County Area Agency on Aging is part of a nationwide federal grant program authorized by the Older Americans Act of 1965. The City of Houston is the grantee agency for our Older Americans Act services for Harris County. HCAAA is a city-county partnership housed in the Houston Health Department. So we provide a plethora of in-home service. Oh, you went to, wait a minute, I am so sorry. Stay right there. Okay. So we provide a plethora of services for seniors who reside in Harris County, 60 and older. I do have like a long PowerPoint, but I am going to get to what is more geared to caregivers. So let's go to slide 4. Okay. Okay. We sponsor programs to provide a sense of well-being, dignity, independence, and the free services of individuals, initiative to older adults and their caregivers in planning, managing their lives through access to and a participation in community-based services and programs provided for benefits, health, and safety. Our main goal is for seniors to age in place comfortably, avoiding institutionalization, and also to give caregivers a break of caring for those loved ones who live with them, either in the same home or in their own home, but they help them out and do everything for them so they can stay in place. I see. So let's go to like in some of those things. This is going to talk about all the services that we provide. I don't know if you guys want me to go through every, but the front door is information and referral and assistance service. So like I said, it staffs older adults by researching, informing them of resources available in the community. We provide also referrals that go out in the community. So if you call us and there's anything we can assist, we can direct you to different resources. Next. We have our benefits counselors. Like it says in theirs, they're certified assist clients and or their caregivers with understanding, applying for Medicare, Medicaid, other public benefits, open enrollment for people with who needs Medicare from October 15th through the 7th. Next. Next. Okay, so this is the one that I near and dear to my heart because it's the one that I've worked for 16 years. We have care coordinations, a process of assessing the needs of an older individual, effectively plan, arrange, coordinate, and follow up on services provided. Caregiver support coordination, which is more geared to you all. A process of assessing the needs of caregiver and care recipient, effectively arrange and coordinate follow-up on services. So you get a case manager. All our services are short-term. You get a case manager who will assist you navigate the system to make sure that services are being provided in the right way. If there's any concerns, any other services that you might need. Next. So like I was saying, like for hands-on assistance with bathing, dressing, grooming. We also have a program called Visiting, which is a partnership that we have from the JCC, in which they pair a senior companion with a senior who lives in the home, and they provide services like socialization, give them a break. It's not for hands-on, meaning personal assistance. It's for companionship. Let me see before I tell you where to go. Keep going. Yes. Next, please. We provide emergency response. Is for those seniors who are homebound, frail, who either they can be by themselves in the home, they have nobody else, so they have that life support emergency response button, so they can assist immediate emergency in case of an emergency, or even for those caregivers that do not live in the same home, this gives them a sense of I'd say safety. So for those seniors, since they live in a separate home, they can press the button. The life alert system will call for emergency and call the caregiver as well. caregiver respite in-home, temporary relief for caregivers, including an array of services provided to independent older individuals who need supervision. So the caregiver respite in-home services, that some of our caregivers, many of you have to work full-time through our services. They can, a care provider comes into the home, assists them with their bathing, dressing, a little cooking, a little cleaning, any services that the senior may have, so the caregiver can continue to work or even take a break. All our services are short-term, as I said before. And next slide, please. Respite care out of home, adult day care is temporary relief to caregivers, including an area of service provided in congregate or residential setting, hospital, nursing home, adult day care, dependent older individual who are in need of supervision. So in that, we have a partnership with Care Partners. We send our clients and they provide adult day care. Next. We also provide ombudsman program is for those residents on long care facilities, or let's say after being hospitalized, you go into a rehab facility or a SNF, and the loved one feel that their loved one is not being taken care of. What we do is we send an advocate to assist and make sure that everything is even. We provide support service, vision, hearing, dental. Next. Medication assistance, mental health counseling. Next. Incontinence supplies and nutritional supplements. So we send a 3-month supply of, you called us, we get the size, we make sure that everything is, we have everything in place, and you get a supply of that. Nutritional supplements, we would need a prescription from the doctor saying how many cans a day and how often. So you would get like Ensure, Boost, Glucerna, etc. Residential repairs, modifications of dwelling occupied by older adults that are essential for health and safety and necessary to remain independent and safe in their home. Next. Congregate meals. We have several throughout, well, like it says in there, 336 locations throughout Harris County. The senior, it's not only to serve a meal, but also to socialize. We have Meals on Wheels, home delivered meals, and Houston Meals for the elderly. Next. Non-emergency transportations through rides. Next. Nutrition service, older adults and their spouse. So for those are for Meals on Wheels and the congregate meals. Keep going. Next. Next. Working background. Next. Target population, older adults, people with disabilities, any age, any disability, intellectual development, physical caregivers, professionals. Keep going. Next. And we provide a call center, option counseling, benefits counseling, housing navigations, assisted with transitioning from institutional living to community living, evidence-based programming, education and training, and respite care. Next.
We have some questions in the chat
Sure.
that I
Go
think
ahead.
are related to your slides where you are. So
Okay.
2 of the questions are about what is considered short-term.
Short-term. Okay. So short-term means it depending on how what kind of services the client may need. We provide 90 days of in-home services. It while the clients identify other resources of long-term care. It can be either while they apply for Health and Human Services Commission, Medicaid, or any other long-term care problem that there's probably insurance has. So we provide where that gap, we make sure that they're covered within their services.
Okay,
I
Perfect.
can't, you want me to look at the, let me see.
perfect. Okay, and I think we have two more, but I
Oh,
will.
yeah, I see something.
Yeah.
I see, assessment appeals for advocacy. Counselors assist with appeals and advocacy if it's correct. What is this? Via front door process. That one, I don't think it's for me. For emergency response service, how long can an adult qualify for the services? Usually what we do is a year of free services, and depending on the need of the senior, we would reevaluate.
Perfect. I think
Mm.
this question was for you, but we will clarify at the end.
Okay.
Because it is a little, I'm not sure, but I just based on the timestamp of the question, I think it was during your presentation. So
Oh,
but we
okay.
can go back to it. Yeah, we can go back
Okay.
to it.
So I guess that's it. And any questions? So we
This
just
is awesome.
answered
Did you
some
give
of
your
it.
number? Did you provide the number?
It was in there. It was in there.
Okay.
The last slide, you went
Okay, it's
back.
etched in my memory, so.
So, I mean, yes, it was the
That's
slide
okay.
right after the one we just had.
Perfect. Awesome. Thank
Okay.
you so much, Libya.
So I'm here. Mhm.
Thank you. I'm turning it over to
You're
Andrea.
welcome.
Hello, everyone. I'm trying to move this over. My name is Andrea Williams. I'm the Vice President of Program at Care Partners. Care Partners is a nonprofit. Our mission is to provide care, education, and support to older adults, including those with dementia and their family caregivers. And our vision is to create compassionate communities of care, which means that no matter where family caregivers or person with dementia accesses our system, they are or where they come from, they will receive services that is dedicated to them receiving the best care that they can. So we provide this compassionate community of care through a variety of services, and I will go through each of them individually, but they're just an illustration that caregivers are able to access our services at any level, the very basic level, which is caregiver education, like we're talking about today on this webinar, but even more intensive care through our Dementia Day Center. Our caregiver support services, we have one-on-one consultation. That is a service that is offered both virtually, it can be offered in person, it can be also offered via Zoom, on the telephone, and it's for caregivers to get their questions answered and to talk to trained professionals. We also offer need one thing, they need to know how to access a nursing home. Or they are new caregiving and they have a variety of questions and needs, able to talk to our care consultants and work through these situations. And it can be something as simple as a one-time call or ongoing. So we have caregivers who have been working with our consultants for quite a while. And so it's just until needs are met or as needs pop up and surface, caregivers, our care consultants are able to answer those questions. We also have support groups. We have over 15 support groups all over the Houston area, from the Woodlands down to Clear Lake, where caregivers can access support. We also have a virtual support group at 10 a.m. and a grief support group that meets every week, Tuesdays and in the afternoon. Caregivers are able to really connect, know that as much information as we can provide, talking to someone who has actually been where you are, going through what you've gone through, provides a lot of value and support to the value to the support that you receive. We also have caregiver education, much like what we're doing here today, learning about how to prepare for care, resources that are available, legal. Hold on, let me if I start the recording again. Okay, there we go. Okay, resources. The resource website is able to help caregivers access local resources. And